Hello, my name is Josh. I'm a licensed massage therapist in North Carolina. Today's video is going to be on thermotherapies, things like heat application and cold application during massages. One of the big things that is used in massage to help relax and relieve pain is actually heat, in the form of hot towels most often, and most oftenly applied on the back and the feet. So that's what today's video will be focused on, especially on the application part where I show you some of the techniques that I use. Please don't take my techniques as the only way or the best way to do that. Note them, use them if you want to. If not, adapt them to how you need. This is simply just a basic introductory video to using hot towels. But before you ever put a client on the table to use these methods, make sure that you consult the client and the intake form, so that you have an idea of things that might be contraindicated to using heat modalities especially. One of the big things that people forget to do is tell their client that they're going to use hot towels. We get into this pattern where we're doing Swedish massages and hot towels just become part of our routine. But that can get you in a little bit of a sticky situation if the person has contraindications that you haven't discussed with them or even reread through their intake form. So I wanted to cover some of those contraindications for heat and as for some for cold as well, even though we won't be covering cold therapies so much in this video. So to begin with, one of the big things you need to consult with your client in the intake form are things like, especially for heat, blood clots, things like deep vein thromboses, who are characterized by unilateral leg swelling, localized heat, redness, and pain. Another thing to look out for is cardiac insufficiency, as well as age. Very old people, very young people need to be consulted especially and talked with about the use of these applications. People with diminished communication abilities need to be discussed with about this as well, so that you can come up with a method or a system so that they can let you know if it's too hot or too cold. Another big thing that people don't really think about a lot, and it's not very common, but it is something that needs to be discussed, is any topical medications, either prescription or non-prescription, need to be discussed. Even some essential oils are not supposed to be used with heat application. Moving on to the cryo ones, the cryo contraindication ones, that is. Raynaud syndrome is something to look out for. Hypertension, again, age, young people, very old people. Circulation complications, things that come from diabetes mellitus and peripheral artery disease need to be discussed. If they present with any of these things, have them consult with their doctor before you do these methods, just so that everybody's on the same page. If the doctor clears them, fine. If not, then you know you can't use it. Not a big deal. Heat and cold applications are big because heat is a vasodilator and cold is a vasoconstrictor. This means that we're moving blood in and out of the capillaries and the cells and the tissues. And by those processes, we have a big effect on those contraindications that I just listed. So they're big things to look out for and discuss with your client before they ever get on the table. It almost seems like a hassle to some therapists to talk about the things that they're going to do in their session, and it's really not. Once you start talking about, hey, I use hot towels in my session, is that something that you're okay with? Or do you have any extreme sensitivities even to heat or cold? If so, let me know now so that I can adjust or not use them if you don't feel comfortable with it. It's not a big deal. You ask them about their pain, just roll it in with that thing right there. So brief pause, and then we'll get into the application.